So my name is Bill Jamison, and we're going to talk about patient education. Before I get into this, I will tell you quickly, many years, my background is in communications. I worked in the New Jersey Department of Health for many years as a communications specialist, and with Rutgers for the last 13 years, actually, as a instructor in various communications projects. So when I put the terms health, patient education up there on the screen, I could think of so many different, over the years that I've been in this field, how many, there were methods to teach patients about how to apply dressings, take care of an elderly parent in the home, take care of an ailing child when you bring them home from the hospital. So patient education could have meant all those things over the years. This is a more broad interpretation or presentation related to patient education. And if we had all the time in the world, I would ask you a bunch of questions, but I'm going to ask you this one. So why do you think this particular curriculum is being presented mostly to healthcare agencies and organizations today? Why is that happening? Keeps them coming back.
Keeps them from coming back.
Oh, keeps them from coming back. Okay, that's good. And all right, and think about the way healthcare is today. It sometimes can say, let's get the patient in, let's get the patient home. There's a lot more home care. Anything else? Patients are discharged sooner so they can take care of themselves at home. Anything else?
Consumers can go anywhere.
There's report cards in the state of New Jersey on how this hospital versus another hospital does cardiac surgery or whatever. Also, and this evolved from a larger project, the Health Literacy Project, people are different. There are lots of different sources of information for patients. So a model for the patient is changing in the sense of there may be people who in the past just said, I'm just coming in, whatever the doctor says, that's what I'm going to do. This is what they told me to take, I'm going to take this. WebMD and 100,000 other sources are available, resources are available to people who are going to be coming in for for health care. I have a friend who's up in the Boston area who's making a decision for a health problem. Should I take the medication or should I have the surgery? And in addition to talking to his friends and family, yada, 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 he's doing thousands and thousands of hours, well, not thousands, but lots of hours on research on websites and reading blogs from people who've had this procedure, and this is the so all that information is going. So when the patient presents in the healthcare agency for care, they may, not always, be predisposed to have a whole bunch of information, questions, and expectations of the healthcare providers. So for that, it's best for us, those people delivering health patient care, to know how to educate the patient in what to dispel rumors, and that's not a really reliable source. The blog that you got from somebody in Vancouver, Canada doesn't really apply. That kind of thing. And the other thing is, in the interest of time, you're finding people with a lot of different languages, religions, ethnicities, gender, race, color, creed, all of that stuff where people are presenting to hospitals now, and we have a more diverse population. So health literacy was something involved in about 10, 12 years ago, research on what do patients need, believe, think, find when they go to healthcare agencies for care. What happens to them, what works for them, and what doesn't. So a lot of the stuff that developed in the Health Literacy Project, which is, as I said, a very large research project, has evolved to what Rutgers is going to call this patient education. So this is And the medical, not only are patients getting educated, but the medical is getting educated. So I start off with this. Of course I'm listening to you, to your expression of spiritual suffering. Don't you see me making eye contact, striking an open posture, leaning towards you and nodding empathetically? This is what the doctor is saying to the patient, because doctors are, this is how you're supposed to engage with your patient and connect with your patient. So that's just one example of how pervasive this information is. Are we teaching the patients what we really want them to get, and are they getting what we really want to say? So just leaning in and showing an open posture doesn't necessarily get it. This is about patient-centered. So patient-centered communication is about systematically involving the patient through the medical exam. Good practice, if, instead of the doctor or the caregiver being the director of all the information and how it flows, you want the patient to give you a dialogue about what their real concerns are. Listening is important in deciding how to give health care. Now, when I've done patient education around the state a couple of times already, and one of the things I asked the caregivers, so what did the patients tell you? And there are a myriad of things that they will tell a nurse. You seem really busy. You can forget about mine. I can go home because you seem really busy here today. Or you get the opposite side of the spectrum, is where someone may say, look, I've been waiting here for a half hour and nobody's talked to me. I don't know. When am I going to get to see the doctor? Different attitudes, different people, all needing care, and all could be presenting in your institution for care. So it's about how do we get that patient engaged, because both of those people exist, and any of you in the health field know that those people come and present. So the idea of health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information. And as this points out here, the doctor will see you now. I can't promise he'll talk to you, but he will see you. I worked with a group of nurses, at one of the healthcare, at one of the medical centers on Monday, it's hard to sometimes really listen, because you've got all of the stuff. I've got to turn the population over. I've only got 5 to 7 minutes to deal with this patient before the next one comes in, and I have to keep the door moving. And also, if you've been in the field of giving care for a while, sometimes you can start, let me see, what's your name? Kala? Very nice. Kala comes in and she starts to tell me about the symptoms and what's troubling her. And I'm Dr. Bill, or Nurse Bill, and I've heard Kala's symptoms for the last 14 years because I'm a professional healthcare provider. And so as she gets into like her second or third sentence, I'm already saying, I know what she's got. I know what she needs. Let me move her along so that I can see the next person. And that's human nature. We sometimes don't, because we've seen Kala before 100 times, maybe 1,000 times. So before she's done, I already know she's got diabetes or hypertension or a problem with her gallbladder or something. I'm already diagnosing, and I don't really hear the whole story. So, and there's nothing wrong with that unless we don't follow, unless we're not aware of it. So because I might start to process that information and make a decision, I'm not really listening to what she's saying, and I don't get the whole story on how what her real symptoms are. And she may be trying to tell me something that I haven't heard before. Or if I let her talk some more and give me more information, if she's the patient-centered communicator in the conversation with the caregiver, she may give me something that I might ordinarily miss by just thinking I've heard this before. This health literacy is about understanding that any patient can have regardless of their literacy level. Cal is very well dressed. She looks like a professional woman. I'm going to assume she's well educated, and she's going to understand the term edema or hypoglycemic. She's a big girl. I can tell that. So I make that decision based on how she presents. Now, if she came in looking different, speaking a different language, Do I just make the assumption that she doesn't understand those terms? And that's part of the patient education, the health literacy. You approach it. Does anybody remember when back in the day we had an AIDS problem that was presenting in the hospitals, and we talked about universal precautions? And that was that treat everybody as if you have to protect yourself against the bodily fluids. Any bodily fluids have to be protected. So you treat all patients in that sense. There's a potential HIV case that I can be handling. The Health Literacy Project talks about patient education being part of this universal acceptance or understanding or idea that all people may have low health literacy regardless of what their socioeconomic status is, their profession, their race, creed, color, age, etc. You make the assumption that I try to speak to Kala or anyone in language that I think they're going to understand. Don't use the term hypoglycemic when you mean something else, or you can say it in a different way. And in the patient education curriculum, really? Okay. In the patient education curriculum, I'm being told that I have to move along. In the patient education curriculum, we do examples with the class where I'll give you a series of words and you'll try to translate them into something that someone who has no healthcare background in terms of clinic or caring, would understand. And so you make the assumption that any patient can have a low health literacy level regardless of who they are. So you go to a lower common denominator. What's the problem with that? Nothing, basically, if you're getting to improve the communication with the patient. So the patient understands why you're treating them, what they're expected to do, and they can teach it back to you. All these are parts of the complete patient education curriculum. I'm just showing you the first, 5 minutes or so, 10 minutes of something, and I'm way behind in that already. Okay, so medical conditions themselves are increased. The processing of information, she comes in to me, I'm sorry to pick on you, but you look perfectly healthy. She comes in to present to me and she starts talking, she seems fine. I don't know how she, or I test her blood pressure and it's way high, okay? And she's not here for hypertension. I know that word. My point is that she may be under stress. She may be worried about it. She may be worried about her health. She may be worried about who's watching the kids at home, or the elderly parent, or the fact that her car didn't start this morning. And that can be causing stress, and the ability for her to understand what I talked to her about in the exchange can be lost because I'm not recognizing her stress level and accounting for that. As I'm trying to rush through this today, medical instructions are often provided quickly and in complex medical terms. I'm the doctor, the healthcare provider, the nurse. I may want to just move Cal along, so I'm going to talk in my language. And sometimes I don't have the time to slow down and say I should speak in plain English. Low literacy patients are low literacy are more likely to have low health literacy. So this is obviously if you're dealing with different cultures and language barriers and things like that, they are twice as likely with low literacy to be hospitalized. Shocking! Even Lucy knew it back then. But basically, if your level of understanding what is going on with your condition, your health concerns or whatever, you are more likely to screw things up and represent to a healthcare facility. And especially in today, as we said, when we go back home and we have to take care of ourselves. I had knee surgery in 1978. I was in the hospital for 3 days. They didn't do arthroscopic surgery then, or at least my doctor didn't. I had it in the 90s again, because I thought I was still 22 years old and could play basketball. And I damaged the knee again, and I was in and out in the morning. So I went home, still had knee surgery, the procedure was different. My treatment, my recovery was much quicker, and because it's different, the care is different. So again, but if you don't have an understanding, you go home and you have somebody taking care of you, or you're giving your own care, you may not understand what needs to be done, and therefore you return, you're going to be re-hospitalized. So this is a quick one. I don't have all the time in the world. But Jill, I see you're taking birth control pills. Tell me how you're taking them. So Jill says to the public health nurse, some days I take 3, some days I don't take any. On weekends I usually take more. The public health nurse says, well, how did the doctor tell you to take them? Jill says, he said take pills to keep me from getting pregnant, and when I have sex, I take the pills when I have sex. Not the way to take birth control pills. Trust me. Jill says, these are real examples, by the way, real interviews. But Jill is a Hispanic, English is a second language, 21 years old, not well educated, comes into the country, goes to a public health clinic, and this is what she did. The interesting thing is that Jill took 3 pills some days, which was interesting. Okay, so studies show that if you have limited health literacy, you are less likely to ask questions, seek health information, and understand information. So even the people with low literacy they're not gonna be the ones who come in and say, I already looked at WebMD, I know what I need. It's time for me to get these hormone replacement drugs because I already diagnosed myself. As opposed to somebody who has no clue. Health literacy, patient education. That's what this is about. Most at risk or in need of these skills for the healthcare provider to provide patient education and to learn some of these techniques are older ethnic minorities, ethnic and racial minorities, limited education, people low socioeconomic status, and chronic disease because they present more, and obviously the more you're there, there's more chance of you have errors in your care that you're delivering. Communications of lay people and health professionals is affected, the skills, health literacy affected by the communication skills, the knowledge of various topics. I want to get to this. These are low literacy red flags. They frequently miss appointments. They forget the registration forms or they're incomplete. They don't fill them out. They make excuses. These are the kinds of things that would be in the full health literacy patient education program. It's the findings of this health literacy project and methods that we will provide through this curriculum to help your staff or you watch for these red flags, know what to do, and to educate your staff who's dealing with your patient population. Obviously, I got a lot to cover here. I probably shouldn't have been so ambitious, but I'm supposed to stop. I got my signal to shut up. The patient education program, it's also available online. I think this is the 2-hour program that we're talking about that I would come into your facility and work with you or your staff, and I think we do a population of about 10 or 12 per class. And there are exercises that I involve the class with so that they get to see the value of some of these skills. There's a mechanism called Teach Back where there's a way for me to ask Calla a question or two, and the way to ask that question to see if she got the message I wanted to deliver. And there are active listening skills and things like that that have to be incorporated into the whole patient education program. This is just a little slice of what a 2-hour day would be like. Any questions?